ever gone to the hospital to get sick? To get sick, yes. Now, people usually go to hospitals when they get, injured or sick to get healthy again. They go see the doctor, right? Get some medication, get fixed up. But according to the National Center of Biotechnology Information, in 2002, 1.7 million people got sick at the hospital. They, of those 1.7 million, 98,987 died. So almost 100,000 people in 2002 died because they went to the hospital. I'm going to teach you guys, or inform you guys, what a nosocomial infection is, give you some examples of what they are, and tell you the risk factors involved in acquiring one. Alright, so nosocomial infection. It is derived from two Greek words, nosos, which means disease, and comion, which means to take care of. So basically you put them together and you get disease while in the care of someone else. That's just that. Some common examples. You guys ever heard of a urinary tract infection? It's the most common example of nosocomial infection patients. They're usually caused by these things. These are called a Foley catheter. They put them in people that are bedridden to help them go to the bathroom so they don't have to keep getting up and going down. According to Lindsay E. Nicole, some other common ones are from surgical wound infection, pneumonia, and bloodstream infection. The next picture. Oh wait. Oh yeah. No, never mind. And also, I think I said that. I don't think that's for a while. You could also just get tuberculosis or the chicken pox from other patients at the hospital. That would also be considered a nosocomial infection. So those are common examples. I'm going to give you the risk factors involved now. According to Kopp v. Wynn, there are three major factors involved with getting a nosocomial infection. The first one is iatrogenic. This is based on the antibiotics they use, what kind of procedures they do on you, if they do a surgery on you and open you up, that exposes you to the bacteria in the hospital, or even just simple hand washing techniques they use in the hospital. The second one is organizational. This is kind of like the layout of the hospital. Okay. Next picture. Oh yeah. See, in this picture in the infirmary, all the patients are in the same room side by side next to each other. So it's not a very good setup because they're, a bunch of sick people next to each other going to get each other sick. And finally, you have the patient risk factors, which are the condition of the patient in the hospital. Is he an old person? Is it a newborn baby? Is it someone who's been injured really badly, or a severe burn? They might have a lower immune system. And so, nosocomial infections are basically any kind of disease or sickness you pick up while you're at the hospital. Show the next picture. That's the patient picture. It's an old sick guy. He's obviously at a higher risk than maybe one of us going in because he's older. But a nosocomial infection is just any disease you acquire while you stay at the hospital. There's many common types, and it can be just about anything. And according to Delthea Ricks, they add an additional $30.5 billion into healthcare in the U.S. alone every year. So, I'm not trying to scare you guys away from going to the hospital, because that's the whole point of going to the hospital. You don't go there unless you're sick or injured. But just wanted you guys to be aware that there's risks involved with going to be